Hi, everyone. Welcome to the Top Lessons. I am your host, Kathy Inglot, and with me today, I have a very distinguished guest. She is an accomplished board-certified family physician, lifestyle medicine physician. Welcome, Dr. Lola Ashaye. Thank you so much, doctor, for joining me today.
Yeah, thank you, Kathy. Thank you for having me.
So today's topic is going to be family medicine and concierge practice, but it also is going to be the top lessons of how family medicine is important and integral to our overall health, and the top lessons you can share with us about why your practice is so important to all of our well-being. Now, I want to go a little bit on your background because you have a distinguished career. You hold your medical degree from Northwestern University. You are a board-certified Diplomate American Board of Family Medicine and Diplomate International Board of Lifestyle Medicine. You opened up your own primary care of In Touch Primary Care as a concierge service in Sugar Land, Houston, Texas. You provide primary care with a personal touch, which I love that statement. You also share your valuable health information and insights on your YouTube channel on a weekly basis. You're a sought-after paid speaker. You've been featured as a guest on numerous platforms, including Afrocentric TV. You've been giving your knowledge and your healthier lifestyle expertise on community centers, health fairs, businesses, empowering your audience on how to live the best life overall, and helping build a healthy lifestyle from all the medical expertise integral to primary care. So with that, we're going to start off with why choose family primary care and why a concierge service?
So I think I knew I wanted to go into medicine the day I shadowed a gynae doctor in high school. So, that can be awkward, right? They're going to do pelvic exams. And when you're 16, you're standing in the corner of the room, trying not to breathe too loud, trying just to disappear. And it was surprising because the patient was completely at ease. Like they just were comfortable. It was like they were catching up with an old friend. And the doctor was calm. He was respectful. There was clearly like a trust factor there. And I remember thinking like, wait, people can actually feel comfortable while doing that? Like,
yeah.
So I was intrigued by it. And it was at that point I knew that I didn't know that yet for sure that I was going to go to medical school, but I knew that I wanted that kind of relationship with people that I helped. And that getting to know patients, was earning that kind of trust, will be very central to whatever I did.
No, that's awesome.
So that was my first thing.
So again, fast forward to medical school, right? And you're now a doctor, but yet there's so many avenues to choose in medicine. So family care is obviously the core of everything that kind of brings together all the other specialties, right? You are at the heart of people saying there's something wrong, I have this pain, but I don't know what it is. And your job is to figure it out, right? To say, look, I think it's this, and I'm going to send you to maybe this specialist, or I think it's something else, and I can actually help you with it. And there's so many other symptoms that can lead us to all these other specialties of medicine. And you're at that core. But at the same time, you decided to do a little bit of a certain different aspect. You developed the concierge service within your medical practice. Can you educate about what that means to someone who hasn't heard of a concierge practice yet?
Yeah, sure. So the idea of concierge practice was not something I planned. Honestly, I mean, if you had asked me in like 2019 if I planned to start my own medical practice, I'll be like, no, not a chance. But it was navigating, working within the system. The system gave me a wake-up call, basically. And it happened with a patient of mine. Let's call him Mr. S. So he had diabetes, and we worked very hard together to get his numbers looking great. I mean, I loved his A1C, got to the level like I was so proud, I was so happy. And then one day he disappeared. Months later, I was trying to figure out, like, why haven't I seen him? Which was strange to even do because I had about 2,000 patients at that point. So the fact that I actually remembered was something. And like a concerned auntie, I gave him a call. I said, "Hey, what happened? We've come this far. Where are you?" And he said, "Oh, I actually tried to come see you and they won't let me." And I was like, "What do you mean they won't let you?" And he said, "Actually, my insurance changed.
Mm-hmm.
You guys no longer take my health insurance plan. And so I can no longer see you." And that was like, okay. And I said, "Okay, so have you found somebody else you can see?" And he's like, "Nope." And this is months later. So I'm just thinking, oh my God, all that hard work. His A1C numbers are probably horrible by now.
Yeah.
He's not, it just felt so pointless.
Yeah.
And I think it was at that moment I started questioning, like, why shall I work this hard only for it to go down the drain not because of the patient, not because of me, but because of the system.
Yeah.
And I started to look for a different way to practice medicine. And honestly, I just sat there one day and I told my husband, I was like, it's either I'm leaving this field, or I have to find a different way. And I was just Googling different things and trying to figure out, and I stumbled upon DPC and concierge care, and it made so much sense.
And I love that story because it shows the other side of why concierge is important versus just the regular doctor checkup, right? And I wanted to distinguish this as a lesson for everyone because I think that story is the best story you could have shared. You showed us the difference as to why spending a little bit extra on your health matters a little bit more versus just going to that doctor once a year and doing just a regular checkup. And I do think there's a little bit of a differential in that kind of patient, though. I think everyone who's healthy by all means and standards and has no issue and has no concerns may be okay with not doing a concierge service. But I think if you have an underlying condition and you have maybe, a medical history that isn't just very simple and straightforward, you may want to specifically sign up for a concierge service because you are in and out of a doctor's office so much more than the average person, right? And you do need that constant checkup. You do need that constant follow-up. And you're not even getting that message from your front desk or from the insurance company, right? Saying, we dropped this patient. They're no longer able to see you. Therefore, you're losing a patient who has a vital, importance to coming to see you. And look, maybe in the one small instance where you would have seen him on the street somewhere, right? And he would have told you this, you would have said that aha moment, but you remembered. And it just happened to be that you are a concerned doctor for your patient and you reached out and it worked out for him to be able to say, how do I get care? Even though my insurance dropped this healthcare coverage, right? So you go, there's this amazing story to this, an amazing lesson to this, to say, do your own follow-up, right? Don't just let the insurance navigate your health style and lifestyle, choices. And you have this concierge service now where patients like patient S who can come to you directly on daily, weekly, monthly basis to say, help me, how do we get back on track with my sugar level, right? And I think it's just so important for people to understand, because if we spend one less latte a week for the year, we can afford the concierge service. And I think it's that type of give and take where people have to do that, mental monetary saving and say, I can save with no issue by cutting out a latte or cutting out a class of X, Y, and Z. And that $20, $30 a week pays for that annual fee of concierge service. And it's really sometimes that simple. Now I think concierge services in every state are different price tags, right? So it may not be as easy as a latte in one place. In New York, it may be a little bit more expensive where I am. And I think it's not as expensive, but it's doable if you maybe cut out 2 lattes. But in Texas, it may be a little bit more where it's just one latte.
It's one, right?
Yeah. So it's that difference of care that you get from your provider. And it's so worth it, right? To have that personal relationship with someone like you who has all the expertise to get to, all that work. Like you said, you did all this work to bring the numbers down. And then within 2 to 3 months, all that work is pointless. And you go, why? And it's so sad because someone of your expertise shouldn't be thinking about leaving the industry, or shouldn't be thinking about leaving the expertise that you have for all these years, because you're frustrated with the system. And I think the worst part is the system is just going to get cheaper and cheaper as we all progress with certain administrations. So we have to fight for, how do we get that extra coverage on our own to be able to bring that in? And it can't be just my insurance dictates what I get. It should be, how do I get a person like you to help me? And I'm sure there's coverage, different types of coverages with different types of people. So it's not a one size fits all by any means, right? Nope. And I think this is why it's important for people to understand that there is this other channel they can go to. It doesn't have to just be a no. It's not and my insurance dropped me. It's a no. It's a, what else is out there? Right. And you were able to set this up to have patients come to you on this one-on-one specialized way to say, help me continue my healthy lifestyle. And I don't have to have, this myriad of, I go to 10 you're the 10th doctor I've seen this year. Mm-hmm. It's one doctor that constantly sees you and knows you on a personal level. And I think you cannot put a price tag on it. I mean, sometimes you can, but in this case, it is worth the price tag. Right. And I think we can find ways to make it work in our daily lifestyle, where it's a latte or whether it's a pair of shoes you don't buy, whatever it is, you stick to it.
And honestly, even going back to, people talk about what you have to pay. I say more of an investment, because the thing about it is, by preventing conditions, by avoiding going to several specialists, like primary care can take care of 80 to 85% of medical conditions. So it can save you a lot more money, a lot more time, save you from spending that bill at the emergency room. So you would get a lot more, like, it's not only about a latte. You're going to end up saving a ton more money in the long run. So, yeah.
And, as the old saying goes, without your health, we have nothing, right? So the primary care physician and your expertise is the first stop, in many cases, the last stop where we need to go, right? To be able to say, I have, maybe a family history of something. How do I prevent this from being me? Exactly. Or if I have a family history of something, how do we ensure that the tests are showing me that I'm preventing this illness or this issue down the road? And if you know that, you're so well, in tuned in your health, and your care for the rest of your life, where you don't need, like you said, that emergency room bill where we're shocked by the number of commas in there, or you have to, now stop your life to deal with this. And what is that cost, right? What are you giving up to ensure now that you're back on the healthy lifestyle track? And that sometimes is, you can't put a price tag on it, right? Because it stops you in wherever you are, like a car accident, and says, hey, now you have to deal with this because you didn't do what you should have. And I think one of the lessons I want to make sure people have and understand with you specifically is, why should we go to a doctor at least once a year? To go get that primary care check at least once a year. I think people so neglect that I'm here to say, why, like a million times why, right? And can you give us a little bit of why that is so vital to our health?
Okay. So the first thing I'll say is, unfortunately, the body doesn't always tell us what's happening to it until it's too late. And there's so many conditions like that where you may feel perfectly fine, but your blood pressure is not. Or your blood sugar is not, and there's no way that you would know except you check. I had a patient, 28-year-old guy, walked into the office, completely fine. We were both talking and everything. I got up to check his heart, put a stethoscope on his heart, and his heart was beating like crazy. And I was like, are you okay? He's like, yeah. And I thought it was me, and I kept trying to adjust my stethoscope. And he, long story short, he was an aphid, 28-year-old in aphid.
Yeah.
And
can you give a little bit more of like what that means to someone who doesn't
yes,
understand?
I'm sorry. Atrial fibrillation.
Yeah.
His heart rate was irregular, and that puts him at a high risk of getting a stroke.
Yeah.
Here he is in the office, and I couldn't believe it. So obviously we did an EKG, found out that he was in atrial fibrillation, called the cardiologist right there and then, just to confirm, started him on a blood thinner that day and had him follow up with the cardiologist. But it's stuff like that. Like, you just never know.
Yeah, for sure.
Right.
And we have this outlook appearance of good, right?
And he didn't feel anything.
And especially the young age, right? 28. Right. It's like, why would you think something is wrong with you at 28?
Yes. And I've had, other instances where there's someone in their 30s with a bad cholesterol level of 230. He had a genetic predisposition for high cholesterol. He felt perfectly. He actually came in because he thought his blood pressure was high. Somebody a dentist had told him his blood pressure was high. So while I was there, I was like, well, let's do all the labs and everything, and this is what we find. So the point is, you don't know until you check. So
correct.
And the earlier we find things, it's so much easier to treat it on the early on. So that's why it's so important, at least once a year. Just go in, get checked out, get your labs done, and that way we can identify things that may be harmful that you may not know, even though you feel completely fine.
So I have a good story, because this is actually the story of being born in a different country, in a different generation. So obviously I was born in 82 in Poland. And, back then there weren't 3D monitors of children and counting toes and fingers and all this other stuff in the depth they are today, right? So fast forward, I'm 31, I think. I start having an issue. Long story short, I go to the ER. I'm now trembling. I can't stop crying. Something is very wrong. I feel like by the minute I'm getting like death is looking at me. Long story short, they take me in. They run 1 million tests. They send me to a CAT scan. And 2 seconds later, the doctor comes and says, "Where's my kidney? Where's one of my kidneys?" And I go, "I don't know. What are you talking about?" He goes, "Have you ever given a kidney?" And I go, "What are you talking about?" And he goes, "You're missing a kidney." And I'm like, "What?" Mind you, I'm 31 years old. And he's like, "Are you kidding? Like, why? How do you not know you're missing a kidney?" I go, "Because I've been healthy up to 31 years old. What's wrong with me?" And he goes, "The one kidney you have is failing. We need to get you to antibiotics and flush your system out as soon as possible." Now, the underlying issue is I took a pill that I thought was an upper for an energy pill. Now, that pill contained, I think, like 10 times the amount of ephedra you're allowed to ever take. And the ephedra is what caused my kidney to start shutting down. Now, long story short, I was in banking at the time, Wall Street, all the pressures. So I took this energy pill just to give myself a little bit more energy, not knowing this thing was going to slowly kill me. However, they found out exactly what was wrong with me, and I was at the ER at the right time to save the one kidney I had. Now, the other little kidney is like a little bean. It's literally tiny, tiny. It never grew. That's what they told me. It never grew. It never actually developed. So because I was healthy, everything pointed to my body's fine. It works fine. And I, like your patient, had no idea there was something wrong with me other than taking this pill, which caused this whole issue of like, I found out I was born with a missing kidney. So I kind of did what every other person does, right? They sent me to a specialist, a nephrologist, which I didn't even know existed until then. So a kidney specialist is called a nephrologist. And I went and I said, and they're like, "Look, I've almost never seen someone like you. You're like a medical phenomenon." And I said, "This is what happened when you're born in, a Soviet country back then. And they don't do all this check that you get now as a baby's getting born and developed, right?" So I'm sure now doctors would tell a mother saying, "Hey, your child is being born without a kidney." But back then it was, 10 toes, 10 fingers looked good, go home. So I think we have to take what we have, and in the country where we are, right, take all those things that we're given as Americans especially, and that we take for granted, the fact that we can go get a health check once a year and it's paid for by most of our insurances. And some of us don't do it. And you go, why, right? You have this ability and this privilege to go get medical check and know at a point in time that all your bloods, all your results came back good. And at least know that, hey, every year I have a good blood work and I should be ensuring that at least all the basic things are okay. Right. And I'm always mad at people who don't do that, right? You go, why aren't you doing that? It's a life lesson. People in different countries and in different parts of the world don't have this ability. They don't have the ability to go to a doctor and see them face to face and say, help me ensure that I'm healthy. So I'm always very taken aback by someone who is privileged, but they don't understand that they're privileged because they're in this bubble of like, oh, this is just what this country, everyone gets offered. And that's not the case, right? There's war-torn countries everywhere where a person only sees a doctor if they get, a bomb falling on them, right? Or something terrible or tragic is happening. So you don't want to take those things just correct, right? And go get the health check once a year with an expert, with a family physician that has that expertise. And again, you are going to bring in the experts, right? That you may not know the answer or the cause of that health issue. And you're going to work with them. And the best answer is, as a concierge practice, you literally go back and you confirm that, what they're working on or what the specialist they're connected to. What is the best overall health for that person, right? What do you do as a group together to ensure that that person is healthier and has that healthy lifestyle going forward?
Yeah.
So I think that's where the concierge service, I think, is an additive to where all the experts are talking to each other, and you're able to be that middle person that guides that person's healthy choices going forward and say, hey, maybe we need to tweak this or we need to tweak that. And in the end, we're all your health experts together.
Yeah. And I want to speak a little bit. I understand to some extent why some people may not understand the value. And it's interesting because when I talk to people about concierge, some people say, well, I'm healthy, I don't need that. And what I realize is people really undervalue primary care. So people are starting to see primary care as just, oh, I talk to my doctor for 5 minutes every year and then they just order tests and I don't even know what the results are and nothing happens after that. So they don't see the value.
Yeah.
And so that can be frustrating, or they can't get in, right, to see their doctor. And that's where having a membership like ours is really nice. And I want to contrast what should be happening for people that may not fully understand. So I'll give an example. So I just saw a 52-year-old woman recently. Let's call her Miss G. She came in for her annual. And yes, we did all the basics. We did the blood pressure. We did the labs. We talked about vaccines. We talked about all the cancer screenings. And that was not it though, right? She was postmenopausal. She had high blood pressure, high cholesterol. She was pre-diabetic. And she didn't really understand that being in menopause was affecting those things, right? And that we could actually lower her long-term health risk with treating her for not just the diabetes and all of that, but also addressing the menopause as well. So we talked about, do you actually have symptoms of menopause? Turned out she did. She actually had severe symptoms of menopause. And then we talked about, okay, how do we go about this? So we talked about the big six of lifestyle medicine: nutrition, physical activity, sleep, stress, substance abuse reduction, and social connection. And then she filled out the menopause questionnaire, and we were able to come up with a plan for the vaginal symptoms of menopause she had, started her on vaginal estrogen, and then we talked about, okay, let's get your lab results and we can discuss your current risks, and then we can talk about whether or not we need to start you on hormone replacement therapy. So this took much longer than 15 minutes, as you can imagine, right? But that would never happen in a traditional primary care practice because we don't have the time.
Yeah.
But that is what's supposed to happen, because here is being proactive about the care, right? Letting her understand that it's not just about how you are now. It's about looking forward, looking ahead, and saying, how can we make sure we're proactive about your care now so that you can have good health long term. So that's what a physical should be. And I understand when people are frustrated when
Yeah.
it's not even close to that.
Correct. And I think, one of the negatives I've heard about primary care is you just go there to get your referral to the other doctor. Right. And I think
Which
that
it
is
shouldn't be.
the wrong assumption. And that is just the negative connotation. Right. So I think everyone needs to kind of stop and force the primary care experience to become not that. Right. To be able to say who and how can you help me get real medical expertise so that it's not just a referral to someone else. Because again, you're going to get all these referrals, let's just say 3 or 4 referrals to whatever is wrong with you. And no one ever puts the pieces together, right? No one ever says, let me call your primary care and see how we can make things work for you. And I think when you have this service of this specialized care, you're so better off in the long term to be able to say, I have someone who cares about me, right? I'm just not a number. I'm just not a patient. That they don't know my first name or last name even. And I think that is where, albeit for a price tag, medicine has now evolved to help get that real, personable expertise to be, again, something that, I think my parents were thinking about or talking about back in the 80s when you had a doctor come to your house, right, and be able to check you in person to person. They made house visits, right? So this is like that house visit experience where it's not technically to your house, but at least you can walk into your office on whatever basis you need and get that one-to-one expertise.
Video. You can be in video visits and making that a little easier too, where they can show you things in their house.
Yeah, perfect. Yeah, exactly. Or, now you can with, telehealth, right? You can do a lot more than you used to do 10 years ago. And people have their own medical devices to hook up to at home if they need that type of expert medical coverage. So with that, I want to ask you a little bit about your own career. Now, obviously, you are very accomplished, but if you can go back to your younger self and at the 18-year-old kind of trajectory, right? What life lessons, what top lessons would you have shared with yourself about your career that you wish you knew back then?
I would say don't ask too many questions. For me, truthfully, I think it was it was a blessing that my 18-year-old self didn't fully understand what she was getting into. Because if someone had showed me a roadmap of everything, all the all-nighters, all the scary new rotations, all the, doing a spinal epidural, drilling a hole in a person's head, like all the stuff that I was going to have to do, I would have said, yeah, that's good. I'm good. I'm just going to,
I'm going to be accountant.
Yeah.
I'm going to go accounting.
That's okay. So I think for me, there was benefit in not knowing too much. And
I love it.
I'm glad that I just kind of saw what was in front of me at the time and just did what was in front of me and did my best there, and then did the next thing and did the next thing and trusted that, over time it was going to work out.
I love that story. And I think there's humor in that story. And there's also there's a lesson there, right? It's if you're staring at the mountain and the walk up the mountain and the enormous weight that may hold, you may just give up. Right? You may give up because you're like, there's no way I'm going to do this. But as they say, if you look at each individual step, you go, I can do a step a day, right? Nothing is overnight. No one's telling you to climb Mount Everest in one day, and it's impossible to do. So if you're doing it day by day, and the lack of awareness sometimes is our best shield, you go, I got this, right? Because at the end of the day, no one thinks about what they're expected to do in 10 years, right? Because we don't have that expertise of what it takes to do that job in 10 years. Right. But when you do that expertise day by day and you build upon it, it is so easily done with that day-to-day, awareness and journey that you just are able to say, I got it. I will be the expert. And I always say to the young people, especially that are kind of at that 18-year-old pivotal part of their career, is it's sometimes good to know what you don't like, right?
Mhm.
You definitely are, some people don't like math and don't like accounting. So why would they ever be accountants, right? It's like if math isn't your thing, you're not going to be a certified CPA or anything else like that. You're just like, that's not for you. But if you love medicine, and like you said, when you were 16 and you were shadowing a doctor, and you're like, I love what that person is doing, how their personal touch with the person is, right? The person felt comfortable and they're able to help, in your cases, sometimes save a life. You are able to really come away with that and you go, I definitely want medicine. I don't know what kind of medicine yet, but I definitely want medicine. And it opens up a whole new happiness of where you get up every day and what makes you happy to bring you that care that you bring to your patients. And I think that lesson of not knowing is such a good lesson for those 18-year-old people to say, don't look at the end result. I was like, look at it as that task day in and day out of what you need to accomplish. And you will absolutely fail, right? You will absolutely take the day where you hate your life or you hate the all-nighter and you're like, why am I doing this? And you're like, because I know what it's for. I know why it will make me happy at the end of the day. And I think when you said this to me first, when we were talking, I was like, you have to share this because people think it's all about, the glitz, the glamour, the medical degrees behind you on the wall. And you're like, if someone knew how much sweat, blood, and tears and cries I've experienced here, they would have said, what are you thinking? And you go, I didn't know it. So I just did it, right? The Nike motto, just do it. I've shared my life story also where, I was working full-time at Goldman and I went to night school at law school and I, doing both at once and you go, how? And you go, because you just do it. I didn't think about 2 years from now. I thought about the night and what I had to do that night. And if I didn't do it, I did it the next day and I just made it happen. And were there sweat, tears and, things thrown? Absolutely. But what I like about people who are very high achievers is you're with people who are like you, right? So one person, when you see them saying, well, that person is a little bit ahead of me, how do I catch up? Right? And you're making each other better because you're constantly feeding off of someone else's achievements and energy. And if you're with people like that, the drive is there to help you along the way. So don't always be the only person in the room that's trying to do it all yourself. Rely on other people's energy and their kind of accomplishments to drive you forward. Because I always say you don't know what that person's doing to help them achieve what they are achieving, but their energy and their kind of go-to spirit is going to help me do it. And if that ever helps you, I recently was at a gym and this person next to me was like a workout crazy person. And I was like ready to give up on like minute 10. I was like, I can't do this. This is too much. I'm like half asleep. And I just looked at this person and they were like 60 years old doing these crazy things. And I was like, if that person can do it, what's my excuse? Right. I was like, no, I got this. I was like, more weight and more faster on the treadmill. And that's the motivation you need in life sometimes. You need that motivation to say, if this doctor did it, how can I do it and do it better? Right? To be able to say, I got it. I'm not only going to be the person, but I'm only going to do better at it. And the concierge service is something that I think is the better aspect where you go, not every doctor did this for 30 years, right? The last 30 years, every doctor kind of went the traditional way. And it's okay to go to the traditional way, but if you can do that specialty where you're giving a little bit more of yourself, why not? Right? And I always say the cost savings is there on something else. So if you can save yourself that, you can invest in yourself and your own health down the road. And one last thing for you. This is a question you haven't been asked, so we're gonna hear your answer nice and live. What is not on your resume that is something special about you?
So actually, not on my resume. I wrote a book.
Okay.
So I wrote a book for mothers of young children. It's called Planning Mommy. I have twin girls, and I wrote it right after the twins. I also have a little boy after that, but it was actually almost right before I had my son.
Okay.
And it really was just a way to be organized. So at the time, I was still working in traditional medicine. I'd been done with my training and all of that, but it was just balancing being a doctor, working and having twins. And I had learned so much in those 4 years. And I just shared that in the book, basically, about how you could organize your life more easily so that you can survive.
You can survive. I was just going to say that. Oh, that's awesome. We're going to have to share your book and ensure the audience has a way to reach and read it and also take your lessons for their own life, because you're just not a regular person, right? You have an established career and a very hard one at it, and you also are a mom, which is a career in itself, right? So how do you make the two work? And for everyone out there who is a mom or planning to be a mom, it is a struggle, right? It is a struggle, and people don't always give you a book to say, here's how to do it. So when you have someone like you, give them a little bit more of lessons to say, do this because it worked for me. It could be something that someone is dying to get their hands on, to be able to say, look, I need all the help in the world I can get. Help me survive this day-to-day struggle.
And it's very short. I made it very short on
that's awesome.
purpose because I was
it's even better because you don't have time to read.
Right. It's on Amazon, Planning Mommy. So if someone needs it, they can get it.
We will link it for sure for everyone to get and be able to share your lessons from the book. So Dr. Lola, thank you so much for your time. I really enjoyed this talk. And for everyone out there, Dr. Lola, we will link her practice. We will link where you can find her, especially if you're in the Texas area and you're looking for someone like her to be your go-to doctor. So you can easily find her. We will ensure everything is on the podcast linked, and all her social media platforms will be linked, so you can go to her directly and find her. So on that, thank you so much for sharing your top lessons with us. I look forward to meeting you in person one day, and also for having you come back, because I'm sure people will love to hear more about your expertise. Primary care, I think, is vital, and you are just one of the experts that I think people will love to hear more from down the road. So on that note, I look forward to another session, and thank you so much for sharing your time.
Thank you, Kathy, and thank you for doing this. This is such important work to encourage people to learn and to learn from others that have gone ahead of them. So thank you so much for doing this.
Thank you. Have an amazing day. All the best.
Thank you. You too.
Bye.
Bye-bye.